State lawmakers set to return to Topeka next month. Governor Laura Kelly keeps Medicaid expansion as her top priority on the agenda. But even with announcing a plan aimed at getting Republican support with a work requirement behind it, GOP leadership at the Kansas House and Senate already saying no.
Sean Logging is taking a look at the session with the introduction of Governor Kelly's 6th Medicaid expansion plan. Sean?
Mike, Rachel, while this is a policy with broad public support, the Republican-controlled Kansas legislature serves as the biggest hurdle to passing Medicaid expansion. Kansas is one of 10 states not to expand. Stories of Kansans caught in the coverage gap are very familiar to April Holman with the Alliance for a Healthy Kansas.
And they really don't have options for getting affordable health care.
April says the gap is people who make too much to qualify for the state's Medicaid program, CanCare, currently capped at 38% of the federal poverty level, but not enough to qualify for the subsidies on the federal health care marketplace, requiring an income of 100% FPL.
I think a lot of people don't realize that. They just think it's an option for everyone, and unfortunately, it's not.
Alliance for a Healthy Kansas has been a longtime advocate for Medicaid expansion in the state. The group is getting ready for the upcoming legislative session.
These are not cash payments that go out to people. No one can survive on their health care insurance. It basically just gives access to affordable health care to people who don't have it.
Governor Laura Kelly detailing her latest attempt. Under expansion, Kansans up to 138% of the federal poverty level could qualify. It includes a work requirement with exemptions and is revenue neutral for the state. But this proposal isn't removing opposition from GOP leadership in the House and Senate.
See it as an expansion of government, and through committee assignments and overseeing how bills move through the process, they have made sure that it doesn't get passed.
The plan is getting some bipartisan support as this issue has importance in rural Kansas.
A lot of rural constituents are affected by it, and a lot of rural hospitals could probably have fewer rural hospitals closing if Medicaid expansion were implemented.
It is also getting support from some Kansas County sheriffs because it would also assist with covering the health care costs of inmates. Now, that cost is currently burdened by the counties. But in statements by Republican leadership, they say that the solution is more options for private insurance, not government.
Well, Sean, what impact did the unwinding of Medicaid this year have on Kansans?
Yes, Rachel, that was a process where renewals resumed after being paused during the pandemic emergency. CanCare data shows nearly 37,000 Kansans were discontinued, with about half of them children. April says this has left some people without insurance, but some still qualify but haven't gotten their paperwork because they've moved to different addresses or other issues.
All right, thank you, Sean.